So this morning I wanted to just not focus on infrastructure work this morning, but mainly to speak on two programs, the bushing program and the farm labor program. I do give a commitment that I will come back probably sometime next week, if not the week thereafter, to give a more update on some of our major projects and where they are, as we have promised that commitment to the general public. So the bushing, let's start with the bushing program, has recommenced, started yesterday. Some of the teams would have started today, and some will start tomorrow. By tomorrow, all teams from throughout the country should be out conducting the bushing program to its extent as we deemed when we started this program. But I think it is important to reiterate the main objective of this program. There are two primary objectives of this program, and it has to do with one, road safety. It is very important for the work that is being done to ensure that the roadways are kept clear and safe for persons who might be entering from minor roads onto the major roadways to avoid or to prevent any incident or accident. And secondly, this is an important program which creates economic activity, especially in our rural communities. So we just want to reiterate that. The program, as we know, we're just coming back because of the recent spike that we had, and as such, we have to be more vigilant as the workers go out there. So we have discussed extensively over the past 2 weeks before we commence to ensure that we prepare the workers to go back out there to do their tasks. As such, we have advocating and also putting in place the fullest adherence to the protocols that are established in our regulations regarding mask mandate, the distancing, physical distancing, and of course sanitizing where necessary or possible. We continue to advocate vaccination for all eligible citizens throughout the country through education, through various programs, through moral suasion. And as such, that is the measure and approach that we are advocating for our workers who are out there at this time. The parliamentary representatives, they have also gone further in terms of their commitment towards this fight against COVID. And they have given a commitment to engage the workers through this program on the job. So within the next fortnight or so, in passing by, you may see parliamentary reps engaging with the workers. They too will be engaging them, talking to them. For some of the persons who might be still on the fence in terms of vaccination and being COVID smart in this particular time. So they have given a strong commitment to go out there, and so you're going to see the representatives over the past 2 weeks, next 2 weeks, and going forward, meeting with various teams and speaking to them about vaccinating and trying to encourage them to get vaccinated. That's for those who have not been vaccinated as yet. We understand the challenge, the difficulties that persons have in making this decision. There are varying competitive information out there, and as a health team, we will speak more this morning. We continue to move forward and continue to encourage as much as possible for persons to do the right thing and make the right decision to get vaxxed, because that is the only way we're going to get out of this going forward. So we want to thank the parliamentary reps for supporting the ministry in this regard, to ensure that our workers do the right thing, to ensure that they can continue to remain safe, and also on a livelihood, an important livelihood going forward. The agriculture farm labor program, this also is a very important program for our farmers, and Cabinet has given the go-ahead for this program to recommence as well. And this program is geared towards significant support for farmers which in turn will see an increase or enhancement in agricultural productivity through the farm labor program. And that is what it is geared for. That is why this investment has been made in this program. And the same protocols apply to persons participating in this program. We are asking you to just, when you come out to do your work, to ensure that you wear your mask, observe the protocols, keep the physical distancing, and to sanitize your hands as much as possible, wash your hands. So that is what we are asking. We are continuing to advocate through more persuasion, vaccination for persons in this group of workers as well who have not yet made the decision to get vaccinated. So these are the two important announcements that we want to reiterate this morning. And I know that sometimes information do get muddled in the public, but we want to reiterate that there is no mandatory request for persons to vaccinate to participate in this program. But we are strongly advocating and also ensuring that persons adhere to the current protocols as regards to the mask, wearing of masks, physical distancing, and sanitizing while they conduct the work during this program. So this is what I just want to announce this morning, and just to reiterate that I will come back at some point in time, hopefully next week post-cabinet briefing, to give some update on our major projects.
Thank you, Senator Cox. Colleagues, any quick questions for Senator Cox before he leaves? As he did promise, he will come back next week, but in case anybody has a quick question, let's do so now. Nancy Maguire, good morning.
Good morning. I'm wondering if you have any idea of the number of workers that you're talking about to speak with over the next few weeks in the farm labor and the debushing. Do you have any idea how many are vaccinated? And who will be accompanying the MPs as they go out to try and convince those that are still hesitant? Thank you.
Thank you very much for that question, Nancy. What I can tell you is that the entire program is geared towards engaging over 3,000 workers through the duration of the course. And each team's is comprised of 15 persons. So at any one point in time, one gang, you have the contractor supervising, I think, about 6 or 7 workers. So let's say about 10 persons or so at any point in time would be engaged by a parliamentary rep. As regards to support for the rep, we have, of course, been working closely with the Ministry of Health, and we expect that we're going to get the support from the Community Health Department whenever the parliamentary reps go out to engage the workers during the conduct of their duty.
That's it for you, Nancy?
Well, I was wondering about if you had any idea of the percentage of people you're going to be persuading in those workers.
I don't have the numbers in terms of who is vaccinated and who is not vaccinated. It's a fluid number. It changes daily, so I can't say. Thank you.
All right, colleagues, thank you so much. Senator Cox, thank you so much for that update. And of course, as you said, he will be back soon. So colleagues, as he mentioned, he will be back soon. So what we'll do here is take a quick break, and we will come back with the team from the Ministry of Health. Once again, one and all, we are back with you as promised for the second part of our post-cabinet press briefing this morning, and we're talking health now. So we have with us Ms. Hannah Julien-St. Paul, Permanent Secretary with responsibility for hospital and community health services, as well as Dr. Tyhiesia Noel, Director of Medical Services, and Dr. Dolland Noel, the head of the COVID-19 Medical Response Team and head of Internal Medicine at the General Hospital. So without any further ado, we'll hand you over to PS Hannah Julien-St. Paul. Good morning to you.
Good morning, Leslie. And morning to our medical director and the head of our COVID-19 response team, Dr. Noel. Good morning to the media and our listening public at large. Leslie, this morning, the Ministry of Health would like to take the opportunity to thank you for welcoming us back to provide an update on the situation as it relates to COVID-19 to our nation. We take this opportunity to provide information on a weekly basis so that persons out there can be informed as to what is currently happening within our health services. As usual, we would touch first on a little bit of the epidemiology of the pandemic and the key defense that we currently use against that pandemic, which is our vaccination program. I will commence from going back to the week of September 21st to September 27th. Within our health system, our hospital, we would have seen an average number of new cases of 113 persons. We had death occurring at the number of 55. Hospitalization during that period was 74. Our vaccination uptake for that said period, first dose administered was 1,296, and our second dose administered was 1,134. with an average test positivity rate of 17.9. We went further to the week of October 5th to October 11th, 2021, and we had an average number of new cases of 31. Death during that period was 18. Hospitalization during that period, 23. And our vaccination uptake during that period, first dose, 951. Second dose administered was 1,918. An average test positivity rate was 7.6, which was still a bit high than the recommended positivity test rate of 5% recommended by World Health Organization as it relates to community spread. Our data showed a weekly decline in COVID-19 new cases, hospitalization, death, and test positivity rate. However, as the COVID-19 situation improved, there has been a decline over the last 3 weeks in the number of persons coming forward to receive their first dose of COVID-19 vaccine. This is a bit troubling for us at the Ministry of Health. It leaves us to ask the question, are we getting comfortable with the decline in the positivity rate? The number of new infections has been dropping consistently in the last 3 weeks. However, one death is one too many. We wish to take the opportunity to appeal to all. Let us not lower our guard because the reduced level of positivity and restrictions. Let us all remember that while the numbers are down, the virus is still in our midst. This encouraging decline in infections came at a price, not only a financial burden to our health system, but also one where we have lost a significant number of our elderly citizens, one where the Ministry of Health had to take measures to reassign its health services to larger health facilities, downscaling the services at the medical stations, and putting on hold our specialist services within the hospital. This created challenges for persons within the affected areas. However, these actions had to be taken to obtain the necessary human resource to create additional healthcare teams to be deployed into communities and provide extended hours of service within the health districts, namely our Surtees Health Center and Guelph Health Center, which currently operates from 8 a.m. to 8 p.m. daily. This had to be done as the demand for emergency services had increased significantly as a result of positive clients needing attention at home. This action allowed the medical team to increase the number of home visits to shut-ins and positive persons. As a result, we had early identification of positive cases, provision of care packages to positive persons for monitoring of their symptoms, creating a mechanism for early diagnosis, quick referrals, and prompt treatment. These measures contributed to a decline in hospitalization, improved patient care, and some improvement in our vaccination coverage, while reducing the burden of emergency response on our General Hospital and Princess Alice Hospital health team. The ministry again would like to salute our courageous healthcare workers who continue to risk their lives while saving others. As we enjoy the relaxed restrictions, let us always keep our thoughts on our healthcare workers, because keeping safe, we also keep them safe. Our health team is encouraged by the decline in the test positivity rate, and as a result, would provide an update on operations within hospital services from the week of October 11th, and some of the foreseen challenges as a result of chronic non-communicable diseases as a fallout for this pandemic.
Thank you, P.S. Hannah Julien-St. Paul, Permanent Secretary with responsibility for hospital services and community health services. We hand over now to Dr. Tyhiesia Noel, Director of Medical Services.
Pleasant good morning to everyone. Permanent Secretary Hannah St. Paul with responsibility for hospital and community services. My colleague, Dr. Dolland Noel, to the media, to the persons listening. Today, we want to give an update on changes that would take place within our hospital services. But before I speak on that, I would like to say that I've been very happy to see the turnout at persons at the various pop-up clinics throughout the length and breadth of Grenada to get tested for COVID-19 and for vaccination. We are really proud of you. We do need to continue to do some work, however, to try to get our numbers up. We want to implore on our population that vaccination is still the best option to boost immunity and to prevent hospitalizations and severe illness. So we encourage one and all, persons of high risk, pediatric persons 12 years and over, we encourage everyone to be vaccinated. Now, based on our current trends, we've noted that there's a significant decrease in the number of active cases we have within our island, Tri-Island state. Presently, we have a total of 321 active cases, and of them, 33 cases are admitted, 28 at the General Hospital and 5 at the Princess Alice Hospital, with no admissions at the Princess Royal Hospital. So based on this, we're noting that there's a significant decrease in the number of cases that we have in hospital in comparison to weeks before. And for that, we're very happy. However, we cannot lose our guard. We still have to continue to follow the guidelines, follow our protocols, and ensure that we do mandatory wearing of face mask and wearing it properly, to continue to hand sanitize, and to continue to avoid large crowds. In light of this decrease in the active cases on island and the decrease in the positivity rate to 8.8% currently, the administration of the General Hospital made a decision to do some changes within our hospital services. So within our hospital services, we have a few things that we would change effective. Some would have started already, and some will continue to be rolled out from next week. The first step would be the resumption of our outpatient clinics. Now, in order for us to resume our outpatient clinics, it is important that the public cooperate with us. Of course, for persons to come into clinic, it would mean that they have to wear their mask properly, and they have to follow the guidelines as set. First, wear your mask, sanitize your hands, and avoid social distancing. Appointments will be given, and the medical records department will contact persons so that they will know what time they need to come to attend their clinic. Please note that you need to be at clinic 15 minutes before. No need to come an hour before, nor 2 hours before, because you will not be allowed to enter the premises. So 15 minutes before your clinic, you can come, and we would let you enter the outpatient area. Persons are asked to please to be on time for your appointment, because of course, if you're not on time, it can help, it would cause a bit of a backup, and we're trying to avoid overcrowding in our outpatient clinic. If you have a fever or any COVID-like symptom, so coughing, runny nose, chills, we would advise you to call the medical records department and reschedule your appointment, because persons with COVID-like symptoms will not be allowed to attend the clinic, except, of course, you have an urgent situation or an emergency. So take note of the following resumptions. From the 11th of October, which was yesterday, we commenced the nephrology clinic, which is the clinic for persons with kidney disease, the oncology clinic, the clinic for persons with cancers, and the physiotherapy department will be starting from next week. From the 18th of October, we start all the other outpatient clinics which are in the outpatient area of the general hospital. Internal medicine, obstetrics and gynecology, surgical department clinics, including general surgery, orthopedics, neurosurgery, ear, nose, and throat, and maxillofacial surgery. So all of these clinics will resume on the 18th of October. From the 1st of November, we will continue to roll out to the Princess Alice Hospital, where we conduct outpatient clinics also. So all the clinics that are generally held at the Princess Alice Hospital will be rolled out from the 1st of November. Princess Royal Hospital, we're also working toward rolling out the clinic from the 1st of November. In terms of surgeries, because we know there are persons who have surgeries pending, and of course, once clinics start, you will have some surgeries to be scheduled. So our elective cases were on hold. However, we continue to do urgent and emergency cases. So now, with the start of our outpatient clinics, we are about to begin to schedule our elective cases. Elective cases we've been starting to schedule from the 1st of November. And of course, for elective surgeries, there's a protocol which has to be followed. All persons coming into General Hospital for surgery will have to have a PCR test done 48 to 72 hours prior to the surgery. And on the morning of the surgery, you'd be expected to do an antigen test. So we just want persons to be reminded of that protocol and to take note. In terms of visitation, we will continue with the existing protocol for visitation with a restriction. And of course, this is in an effort to try and curb spread within our hospital services. In terms of patients who are admitted to the isolation unit, the persons who are positive for COVID-19, we established the COVID-19 patient liaison group, which was in an effort to improve communication between family members and the patients and the physicians within that unit, so that persons can get an update on the status of their family members while in the isolation unit. So this will continue. On the other wards, we will continue with the same protocols that exist. So we have a no visitation policy right now. However, there are exceptions to the rule. So persons coming in to see pediatric cases, persons coming in to see persons who are in ICU, and labor and delivery are exempted. However, they are expected to do an antigen test on arrival at the General Hospital. So these are some of the changes that will take place in the next few weeks, and we just want the public to cooperate with us and to help us as we try to contain the spread and prevent it from coming into our hospital services area. We want to implore, please, the numbers are decreasing. However, in order to flatten the curve, as we say, or to maintain that curve on a downward trend, behaviors is very important. We need to ensure that we maintain good behaviors to prevent this spread. And what behaviors are we speaking about? Mandatory wearing of face masks, constant sanitizing of your hands, and avoiding crowds as much as is possible. If we continue to do these things, it will help to continue to decrease the numbers and flatten the curve. And I know we're all looking forward to this. And of course, most importantly, to boost immunity, prevent severe illness, and to prevent hospitalizations, we implore you to get vaccinated. It is still the best choice. We want to encourage persons, particularly the high-risk group, persons 60 and over, persons with comorbidities, and of course, I want to encourage as a pediatrician that persons 12 years and over should get vaccinated as well. So let's all get vaccinated. Let us decrease the number of COVID cases, and let us increase the numbers of vaccinated persons. Thank you very much.
Thank you so much, Dr. Tyhiesia Donald, for that comprehensive report. We go now to Dr. Dolland Noel, the head of the COVID-19 Medical Response Team and head of internal medicine at the General Hospital. Dr. Dolland Noel, good morning to you.
Good morning, and good morning to my colleagues and to the listening and viewing audience. Now, as a clinician, the very first thing I would like to mention is that we've been through, in the last 7 years, 3 outbreaks. One of them was, the first one was chikungunya, the second was Zika, and now we have that pandemic, which is the COVID-19. Now, from the chikungunya outbreak in Grenada, a large percentage of the population was affected. And this is almost 7 years down the road. And we are still seeing a sequelae from that outbreak. There are people that we're still seeing today who have persistent arthritis from the chikungunya outbreak. Some of them are very, very similar to the classic rheumatoid arthritis, and some of them have antibodies positive. Now, my point is, viral infections usually have a sequelae. So it's always best to protect ourselves and prevent us from getting it in the first place. Now, secondly, what I do want to mention is that COVID-19 is no different. And I can tell you as the clinician from experience what we're seeing, there are already people who have a sequelae of COVID-19, those who have recovered. And what happens? Usually the course of the illness is about 7 to 14 days. Most patients who come through our institution recover and are discharged within 7 to 14 days. However, there are some people who develop what you call a post-COVID syndrome. There are many terms for it. Some literature refer to it as chronic COVID-19. Some studies refer to it as post-acute sequelae of COVID-19. But the long and short of it is after you have recovered, there are some people who develop new symptoms or have a persistence of the ongoing symptoms, and we refer to that as post-COVID syndrome or post-acute sequelae of COVID-19. So what I want to stress to you is that there are some of you out there who may have had mild disease, because 80% of the population who are affected with COVID-19 going to have mild disease. A little body aches, a little headache, a little fever, and you may recover without medical attention. What's about that other 20% who may have moderate to severe disease? Now, anyone, any category, the people who had mild disease, the people who had moderate disease, and the people who had severe disease, all of them can develop a post-COVID syndrome. What are the most common manifestations that we are seeing thus far after you recover from COVID? And usually, those symptoms develop after 4 weeks or so, and they may persist for months. We are seeing people who have what you call a chronic fatigue syndrome. They feel tired all the time. And this is a sequelae of the COVID-19. There are some people who may have dyspnea, a persistence of the shortness of breath. There are some people who may have a persistence of the cough. There are some people who may take weeks before they regain the sense of smell. So all of that are some of the physical symptoms that people may experience after they have initially recovered from COVID-19. So we refer to that as a post-COVID syndrome, or in simple tongue, long COVID. And in long COVID, those symptoms, it may be new symptoms or a persistence of the symptoms that you may have experienced before. Now, there are other minor symptoms that may persist, like your joint pain, your body ache, your dizziness, and all of that. But there are some people who have a persistence of neurological symptoms. For example, we have patients who develop depression. And it's not difficult to understand somebody having gone through moderate or severe COVID and becoming depressed after. It's really, really a serious illness. There are some people who develop what we call post-traumatic stress disorder. There are some people who develop anxiety. And all of those are what we define as the post-COVID syndrome or long COVID. It's a sequelae of that viral infection. So there are many, many different manifestations of post-COVID syndrome that persist weeks and even months after you may have recovered from the initial viral infection. So it is very, very important that we recognize that, because quite often you can have readmission. People have persistence of the symptoms, or they develop new symptoms and see the need to return for health care. But never underestimate the psychological consequences or the psychological sequelae with the depression, the anxiety, the post-traumatic stress disorder. All of those are sequelae of COVID-19 infection. There are also people who have been admitted to critical care. And those people also get a post-intensive care syndrome as well, where they may have the same difficulty sleeping, impaired memory and concentration, depression, and all of that. So we have to sort of monitor for that, be supportive, get them counseling where necessary, and follow up. So my whole point is we should never underestimate COVID-19. And even though our numbers are decreasing, even though our positivity rate is decreasing, some people will have a sequelae of COVID-19. So it's not a condition to be taken lightly. And that emphasizes to the 2/3 of the population who may not have had it, to take the necessary measures to prevent them getting COVID. Don't be fooled or be misled by the 80% who have had mild disease, because you may not be part of that 80% if there is another surge or another outbreak. And because 2/3 of the population is unvaccinated, we are still at risk of getting surges. So it's quite possible in the near future, if our vaccination rate remains low, we can have another outbreak of COVID-19. You may be in that 80% who are asymptomatic, you have infection but no symptoms, but you may be in that 20% who have moderate to severe disease with its complications. And the complications of COVID-19, for those of us as clinicians who are witnessing it firsthand, it is not simple. Patients get many complications, from pneumonia in the lung to a condition we call ARDS, where they're unable to breathe and have to get high flow oxygen or ventilatory support. They get multi-organ failure, kidney failure, liver failure, exacerbation of the heart failure. So there are many complications. Some of them get neurological problems like strokes and all of that. So it is not something to take simply. So this is why I'm admonishing you that we are still vulnerable, because more than 66% of the population is not yet vaccinated to give us that protection. So we're at risk still, and we should never let our guard down. As my medical director mentioned, we have to continue to take all the precautions to prevent another surge and the comorbidities that come with that surge as well. The second thing I would like to mention as a clinician is what we're seeing happening now. And this is not new. Let me tell you what the trend is in Grenada. In Grenada, we have spikes in hospital admissions at certain times during the year. The most strokes we see in Grenada, the most diabetic emergencies we see in Grenada is after Christmas and after Carnival. Now, the positivity rate for COVID-19 is declining, and we're seeing an increase in the people with chronic disease coming into hospital now. So it's very, very important for the people out there who have chronic illnesses like diabetes, hypertension, strokes, heart disease, kidney disease, to pay attention to the health, pay attention to the chronic disease, because they are the vulnerable population and they're at risk of complication. So we are seeing now, as the numbers are going down, an increase in admissions from chronic disease. So my appeal to the population is to pay attention to your health, take personal responsibility for your health, pay attention to your diet, be compliant with your medication. And I'm urging the families of the people with chronic disease to provide them with the support, the family support, the social support. If you see somebody is diabetic, don't sit in the rum shop with them and drink half a bottle of rum. Encourage them to take care of their chronic disease. So it is all of us part to play to ensure that we have a healthy population.
Thank you very much, Dr. Dolland Noel. I hope people are listening. That's a lot of good information from each and every one of you. I do hope people are listening. Colleagues, good morning. You've heard from everyone here this morning. Are you ready with your questions? GBN, good morning. Go right ahead.
Hi, good morning to everyone.
Are you there, Chrislina?
Yes, I am. Good morning to everyone. I said I have a few questions for your panel. First for Dr. Donald, Tyhiesia Donald, right? I have to get it right. So Dr. Donald, my questions to you. You mentioned that persons who have to do surgeries would have to first get a PCR test done. For persons who are fully vaccinated, would that still be the case? The next question is the hospital still taking blood from people, blood samples? And if someone is half or fully vaccinated, can they give blood? That's 3 of my questions to Dr. Donald. The other question to Dr. Donald would be, would patients be able to access cardiological services? As you mentioned, the recommencement of some of the hospital services would persons be able to access those services? That's for Dr. Donald. For Dr. Noel.
All right, just Christina, just a second, please. Just let Dr. Donald answer the questions, and then you'll go ahead. Just 1 second.
No problem.
So good morning, Christina. Thank you for your questions. Yes, so even though you're fully vaccinated, you are still required to do a PCR test prior to surgery, 48 to 72 hours prior. In terms of the cardiology services, yes, we will be having resumption of cardiology services as well, and this would start on the 18th of October. So next Monday, we'll start back with our cardiology services. In terms of the blood transfusions, so persons who would have had COVID or those who were vaccinated first or second dose, you can donate blood after 2 months. So yes, you can, but after 2 months. Thank you.
All right, Christina, can you go ahead with your other questions now?
Thank you very much. The other questions will go to Dr. Noel. I don't want to get tied up, so I wouldn't mention the first name. So Dr. Noel, these questions go to you. What would you recommend for those persons experiencing the symptoms that you made mention of who have had COVID? What would you recommend that they do if they are to be experiencing those symptoms? And in case of people with the chronic diseases that you say now that you're seeing an increase in hospitalization of those persons, it's not the normal time of the year when you would have experienced that. What do you think is the contributing factor to that increase now?
All right, thank you very much. Very good questions. Now, the treatment of post-COVID syndrome is individualized and is basically symptomatic treatment. Now, the patients who have, for example, persistent cough beyond 4 weeks after having recovered from COVID-19, they're treated symptomatically with cough suppressants. Sometimes they may require some oral steroids and so to help them recover from that. But most time the treatment is symptomatic. For those who are critically ill and had COVID pneumonia or ARDS, then they have to have further investigations like x-rays and so, sometimes even CT scan to see if they develop fibrosis of the lung and be treated accordingly. Again, treatment with steroids and bronchodilator inhalers and all of that. So people experience post-COVID syndrome have to consult with their physicians to obtain the proper investigation and diagnostic modalities and be treated appropriately. Now, I should also mention, in answer to your second question, now, just as we are seeing an increase in the chronic disease now, after this surge of COVID with the Delta variant, we saw the same thing last year in April, because people use that opportunity to stop taking medications. Now, sometime it may not have been entirely some individual fault because they may not have had that access to care because of the small periods of lockdown and all of that, and the closure of some of the health facilities. But by and large, we see that increase in chronic disease admission not only after the festive season, but we have witnessed that in periods of lockdown like previously as well. So in managing a chronic disease, an individual have to take responsibility for their health. An individual have to eat healthy and follow the dietary guidelines of the healthcare providers. They have to exercise and they have to take the appropriate medication prescribed by the healthcare providers. So it's up to the individual to ensure that they have adequate amount of medication. And I should mention that for patients who follow at hospital, for example, even if there have been a temporary suspension, people were still showing up to have prescription filled and all of that. So I think as a society, we have to reach at a level where people take responsibility for their health and ensure that they follow proper lifestyle changes in terms of the diet, the exercise, and compliance with medication. Yes, for some people, the lack of availability because of closures of some center may be a factor as well.
Okay, thank you very much. Nancy McGuire, good morning.
Good morning. I'm wondering on these patients that develop these long-term symptoms, do you have any idea of the percentage of the patients here that happens to? And I'm wondering as well, community spread is still alive and well, I assume. And I think now people seeing the positivity rate go down, what are the actions taking place to, to address the hesitancy among people, including people that feel because they have some underlying condition that they shouldn't take the vaccine? That still seems to be a popular misconception in the public. Thank you.
So with regards to our plan to increase the percentage of our population that receive vaccination for COVID-19, we have ongoing education. So we continue to do education on social media, in smaller groups, in different institutions. So education continues to take place. We also have pop-up clinics, and at most of the pop-up clinics, we also have healthcare providers who are present at these clinics and who offer guidance in terms of vaccination for persons who are still hesitant. I know the approach that's taken in most of the clinics is that once you got tested and your vaccination status is nil, then we do a bit of counseling, we do a little educative session with you, we try to clarify all the doubts and try to see how we can get you to accept the importance of vaccination. So the education drive continues. Pop-up clinics will continue. So we have not stopped educating the public on this. You would have seen a lot of pop-ups coming up on our Facebook page. You would hear a lot of PSAs coming out on the different media sources. So we continue to educate. I mean, education is the key to this. And also we have the pop-up clinics where persons can actually have a face-to-face engagement with a healthcare provider who can advise on this. So we continue, and we would ask that the media too, that they assist us, in this whole drive to educate our public on the importance of vaccination, particularly in persons with underlying illness, but it's really for everyone. So we don't want persons to think it's only the persons with underlying illness. So from 12 years and over, you can be vaccinated. So we encourage everyone 12 years and over to think about it, read, call your physician if you have doubts, and get vaccinated, because it is still our best choice.
If I may answer the first part of your question, in terms of the percentage, I think overall maybe about over 20% of people may experience post-COVID or long COVID syndrome. But the common manifestations that we are seeing here so far is quite a bit of people presenting with chronic fatigue. They're telling they have recovered completely, the pneumonia have resolved, they have gone home, but they're just tired. And it's a debilitating fatigue that improves over time. The other thing we see is sometimes a persistent of the cough that normally would resolve over time with treatment. We have seen some people who develop depression, who we refer to psychiatry for assistance. And as a matter of fact, the psychiatry is very, very much involved in the management of our patients. They would come into the isolation unit and do the assessments. We have seen some people who develop cognitive impairment, like mild dementia, as they're recovering from COVID-19. So the chronic fatigue is one of the most common post-COVID syndrome we're seeing. The cough, the persistence of shortness of breath, those are some of the common manifestations that we are seeing in the post-COVID syndrome.
Any other question from you, Nancy?
No, thank you, that's good.
Okay, great. Linda Straker, good morning.
Good morning to you, Les, and the panel. My first question is to Dr. Tyhiesia Donald. She mentioned about the persons who have to get surgery and having to do a PCR. Can she tell us whether or not, who pays for that PCR? Is it something that is done when you get to the hospital, you go and you get it done? Or is it a cost to the person who have to also take the surgery as an additional cost? And my other question is, either one of them can answer it. Based on the data provided from the Ministry of Health, we would have had more than 5,000 persons becoming infected in that first wave as we describe it. Out of that 5,000 plus, we have seen the data showing when it comes to deaths, the number of persons who were vaccinated, who was partially vaccinated, who was fully vaccinated. There's a nice little percentage in the corner there. Has any research or any determination, anything been done to determine the persons who have been infected? What now is the level of vaccination? Anything has been done to determine people who have become infected, whether or not they were partially, fully, or no vaccinated at all? And in addition to that, I'm sure each one of us would know of someone who would have shown all the symptoms we read about or we hear about with COVID, did not get tested and did not seek medical attention, but would have used home remedies, or they would have had it mild, and in some cases, they just couldn't be bothered. What advice would you give now as a clinician and a doctor to these persons to determine what can happen to them maybe in the long term or immediate? And my final question for now is, Dr. Donald mentioned about the sequelae and the long-term effects of this, and we are now 7 years into Zika and CHIKV. Can you tell us whether or not COVID is only 2 years, going on to the second year actually? Has there been any projection from the science world as to what are some of the more long-term COVID that can be experienced? Like in the case of CHIKV, you said 7 years and people still having arthritis, flares up, and so is because we are looking down the road. Are we going to have a nation of really sick people down the road in the next 10, 20 years? What are some of this very long-term effect that is projected to happen with long-term COVID? Thanks.
Right, so I'll take the last part of the question. Now, there are a lot of ongoing studies in terms of the post-COVID sequelae. A lot of the people who have mild symptoms, usually by about 4 months, it may resolve. For example, there are some people who recover from COVID and still have inability to smell. The anosmia, the sense of smell, hasn't recovered. But then people being followed, in cohorts being followed, by usually 3 months or so, some of those people recover the sense of smell. Some of the people that I'm seeing with the chronic fatigue, after about 3-4 weeks, they start to recover. But to get information on the very long-term sequelae, we have to wait on the ongoing studies, because there are studies ongoing, people being followed to see what is the long-term sequelae of COVID-19. Right, so yes, remember we said 80% of people who have COVID-19 may be asymptomatic. They may have the disease, they can spread it, but they don't have symptoms. Some of them may have only mild symptoms, like a little cough, a little body aches, a little headache, and they may not seek medical attention. It is not a good thing, because for our statistics, it's important that the Ministry of Health get a true and accurate reflection of the people infected. So I know there are people who have had mild COVID and have not seek testing, and this is really not good for our data. Right, but they may develop, the people with mild symptoms can still develop post-COVID syndrome. Like later on, they have a persistence of the symptoms or develop new symptoms like the breathlessness, the cough, the fatigue, and all of that. They can still seek medical attention and be treated for the post-COVID syndrome. But the serious neurological symptoms like confusion and cognitive impairment and all of that we see is usually people with moderate to severe disease and those who are hospitalized. But anybody, including those with mild COVID, can develop a post-COVID syndrome and have those sequelae of the fatigue and all of that. But my advice is once it happens, they should seek medical attention so that they can get some assistance. But I want to encourage Grenadians that if you know you have symptoms consistent with COVID-19 or suggestive of COVID-19, please visit a health facility and get tested so that the Ministry of Health can get good data.
So Linda, with regards to the PCR test for persons who are booked for surgery, now the COVID pandemic came and we had to make a lot of adjustments in terms of protocols and so. Persons for surgery all do what we call a pre-op check, which includes blood tests, sometimes X-ray, ultrasounds, ECGs. So because of the COVID-19 pandemic, one of the added things to the pre-op check was that of a PCR test. So yes, the PCR test has a cost. It's $135. Persons will do it 48 to 72 hours prior. And this PCR testing is to assist in caring for and protecting both patients and staff within the operating theater setting, which is a very high-risk area. So we need to know their status prior to surgery because added precautions would be taken once they're known to be positive. The antigen testing, which is done the actual just before the surgery, it's free of cost. So this is at no charge to the patient. So thank you. So the data for the persons who were infected, it was collected. So we would have to, tabulate it and bring it back to you in another briefing. But yes, that data was collected.
Thank you. MTV, good morning.
Hi, good morning. My question is for Dr. Noel. You spoke a lot about the patients who have contracted COVID and flu, but we have something that there's some information about based on it, pseudo-COVID symptoms. Have you come across individuals who are experiencing any of these pseudo-COVID symptoms, and if so, what measures are in place for these individuals?
Right, thank you for your question. Now, from my end, where I'm at the clinical end, we don't really see patients with pseudo-COVID symptoms. The patients we all see are patients who are clinically ill with COVID and are usually antigen and PCR positive. But pseudo-COVID patients, they need counseling as well.
That's it for you, MTV. All right, so let's move on to Nisha St. Paul. Nisha, good morning.
Good morning, everyone. Are you hearing me?
Yes, we are. Go right ahead.
Okay, so my question as a follow-up to one of the questions asked by my colleagues regarding the PCR test. We're saying that vaccination stops the spread, or it helps stop the spread, and it provides some form of immunity. Can you explain, for those of us who do not understand, why is it that the PCR test is still required for persons who are fully vaccinated, in light of the fact that these are the persons who are fully vaccinated? They are the ones who are able to access certain services and businesses and so on. So can you please explain the need for the PCR test even though you're fully vaccinated?
So thank you for that question, Nisha. In terms of the vaccination, so what vaccination does, it helps to boost your immunity And through that boosting your immunity, it helps to prevent severe illness and hospitalization. It doesn't mean that if a person is vaccinated that they cannot transmit COVID-19. They can still transmit. Therefore, in the operating theater setting, it's a closed unit with air condition, and it's a very it's a high risk unit because persons within the operating theater are intubated and ventilated, meaning that they put the tube down to your throat, and this type of procedure is what we call a high risk procedure for transmission for COVID-19. So persons who would be undergoing any form of surgical intervention, it's a high risk for the anesthesis, for all the persons working within the operating theater. And even though you're fully vaccinated, you can still transmit the virus. You may not develop severe illness, you may not be hospitalized, you may present with mild symptoms. However, you can still transmit. Therefore, it's extremely important, particularly for the operating theater, if no other place, for there in particular, that we have person status. Because you wouldn't want to have a person who is positive within your operating theater unknowingly. And of course, as you know, with every other procedure, all the necessary precautions are taken. But of course, once you know a person is positive, extra precautions would be taken. So you want to ensure that you know the status so you can do all the necessary things. And it's not just to protect the patient, but to protect the staff members as well. So you have to protect the person who is putting the patient to sleep. You have to protect the surgeon, the nurses. So it's to protect staff and fellow patients who would be within that same area. So vaccination, it helps to boost your immunity. It helps to prevent severe illness. It helps to prevent hospitalization. However, fully vaccinated persons can still transmit COVID, hence the need to have a PCR test prior to surgery, because the surgical theater or the operating theater is a high-risk area for transmission for COVID because of the type of procedures that they do within the operating theater.
Any other question from you, Nisha?
That's it. Thank you.
All right, great. Thank you. Linda Straker, you have follow-up questions. We're getting ready to wrap things up. So, Linda, go right ahead.
Yes, thanks. My question, I don't know which one of them will be able to answer that. Can you tell us how much samples have been sent to CAFA for the duration of the peak? And what are the variants that came back? I know we focus a lot on Delta. Was it only Delta that was showing up in Grenada, or we would have had others? And the other thing I will need, now when we look at the regulations, there is exemption made for persons not to have the vaccine. There is a constant stress on becoming vaccinated, but the regulation itself provides for an exemption on medical and religious grounds. Can any other medical persons there share with us what medical ground can be used for not getting the vaccine, and possibly if they know what is the religious ground? How are these things defined and decided? Thanks.
So I would respond, and I'll have my colleague respond to that as well. So in terms of the medical reasons for exemption for vaccination, of the medical reasons for this is persons who are allergic to a component of the vaccine. So there are persons who react to just one little element within the vaccine, and if you had an allergic reaction, or if based on the component of the vaccine you are known to be allergic to any of these components, then that would be a reason for exemption medically. However, in terms of persons with the underlying illnesses and so, it's actually an indication for vaccination, because these are the persons who are at higher risk of developing severe illness. And I'll let Dr. Noel add on to that as well.
Right, there are not much cases where exemptions, in my opinion, can be granted. I have been approached by many people for exemptions because they have sickle cell, they have lupus, they have rheumatoid arthritis. And these are not contraindication to receiving the vaccine. As a matter of fact, those people are in high-risk categories, and they are the ones that require the vaccine more than anybody else because of the already weakened immune system. And we have to bear in mind that those people with the chronic disease, the autoimmune disorders, the heart disease, the elderly, they already have a weakened immune system. So getting the vaccine where they can mount an immune response and develop antibodies so that if they do come in contact with the virus, they already have some neutralizing antibodies to help them fight off an infection. So the severity of the illness and hospitalization and death will be reduced. So that population of people who are most vulnerable are the population of people who will benefit most from the vaccine. And I can tell you straight out, there was only one person that I recommended to hold off from the vaccine because that person had an autoimmune condition called ITP, and the platelet count was only 21,000. So I advised to hold off and let's get the platelet count up, and then you will get the vaccine. Now, there are some people on cancer chemotherapy, immunotherapy, that is going to suppress the immune system to such a great extent that giving them the vaccine, they may not actually mount a good immune response. Those people would advise them to wait until the course of treatment is finished and the immune system have a little chance to recover and give them the vaccine. Beyond that, most category of people are not to be exempted from taking the vaccine. I don't know of any religious reason why people can be exempted. They may have the personal belief. But medically, there are very, very few contraindications to taking the vaccine. And the people who think that they need an exemption are oftentimes the people who need most to take the vaccine to give them some protection. Because I can tell you that mortality from COVID-19 and severe disease is from the category of people who are most vulnerable. Vulnerable, diabetics, hypertensive, autoimmune disorder, age over 60, obese with body mass index more than 30, cancer patients, heart disease patients, stroke patients, chronic kidney disease patients, sickle cell disease, lupus, autoimmune disorders. That is a high-risk vulnerable population. And this group needs to take the vaccine, including the elderly.
All right, so thank you very much, Linda. So Nancy McGuire, I understand you have a follow-up question. That will be the last question, and then we'll take closing comments. Nancy, go ahead quickly, please.
Thank you. For Dr. Noel, head of the COVID response team, has there been any discussions in the team with respect to boosters for adults, people that have already had their 2 doses and past months have gone? Thank you.
Very good question. Now, what I can tell you, I mean, yes, we're a small country, but sometimes we do our own investigations too. There were studies that showed that the people from the UK cohort who got AstraZeneca vaccine in December of 2020 are still showing immunity. Now, you may have heard of countries like Israel that thought it was necessary to give their population a booster dose of Pfizer vaccine. And booster is approved in several other countries for the Pfizer vaccine. It's very early in the game. Studies are ongoing. We don't know how long immunity will last, but we know immunity will last for quite a few months. The AstraZeneca, I can tell you, immunity lasts beyond 8 months. So those of you who have AstraZeneca vaccine, which has been rolling out since December, and tests done, because what is done in those studies, they check the antibody level of that cohort of people in the study periodically. So they're able to assess how long the immunity goes on for. So the immunity for people who got AstraZeneca goes on for months. So at the time we roll out the vaccine, most of the people who got AstraZeneca would still be immune. Pfizer is only recently been released. So people should still be immune. Beyond 6 months, we don't know if a booster may be required. We just have to wait and see for the clinical trials to tell us how long does the immunity from the Pfizer vaccine actually last. So, and that can be, studies can be done, people antibodies can be checked to see if they're still immune, if they still have antibodies against the SARS-CoV-2 months down the road after the vaccine. So we have to rely on the clinical trials that is done in other countries to get the answer to that question. But I must say that there are countries where people are being given the Pfizer booster after 6 months or so.
Thank you very much, everyone. So, Dr. Donald and Noel, while we're with you, we'll just take closing comments from you, and then we'll go to Dr. Tyhiesia Noel, and then PS Julien-St. Paul.
Right, so my closing remarks is actually to my people, like Eric Matthew Garris always referred to Grenadians as my people. Yeah, we care about you. The fact that restrictions are lifted does not mean that we're out of the woods. I want to urge all of you to continue following the basic precautions. Do not let your guard down. COVID-19 and Delta variant is not something to play with because we don't know who would be in the severe to critical category. So take all the precautions that our medical director mentioned with your social distancing where possible, your hand washing, your wearing of mask. And I could never stop emphasizing the importance of wearing masks. I have come face to face with COVID patients not knowing that they have COVID-19. And because I was wearing a mask, I have not come down with COVID-19. And I wash my hands frequently. And I know many of the doctors in the emergency room came face to face with COVID patients, but they were wearing the protective equipment, the mask, and they were sanitizing. So do not underestimate the power of wearing your mask. It is very, very important. And sanitizing frequently, because remember I mentioned before, the virus can survive on surfaces, especially metallic surfaces, for days. So washing your hands frequently to prevent yourself from touching your eyes, your nose, and your mouth to give yourself the virus is critical. And it's a practice that must be continued so that we don't get another wave. And also remember that if you're in enclosed places, because I'm passing and I'm seeing crowds inside of the bars and so. Now, if you're in an enclosed area like a bar, and people are coughing and sneezing without masks, that virus can linger in the air for up to 3 hours. And you're putting yourself at risk by not wearing a mask or wearing it below your chin or below your nose. And I can't tell you how much it impacts us when we pass and we see this thing happening. So please, and those of you who still have doubts on vaccination, please dispel that doubt. Remember, technology has advanced, science have advanced, and in the middle of a pandemic, technology was there at our fingertip to give us the ability to develop a vaccine and test a vaccine in record time. And nobody said vaccine don't have side effects, but the side effects are minimal. 1 in 10 million, 2 in 10 million, people worry about clots. But let me tell you that COVID-19 infection gives you much more clots, venous and arterial thrombosis, than the vaccine. And that can be fatal in COVID-19. So please, we have an opportunity to prep our immune system to make antibodies so that if we do encounter COVID-19, we have some protection, some neutralizing antibodies to fight the virus. So let us make use of that. And please do not let your guard down, because with 66% of the population unvaccinated, we are still very much a vulnerable population. And do not for one moment think that if you're fully vaccinated, you cannot transmit the virus. The virus can still colonize your nasal passage and you can transmit it. Yes, transmission is reduced if you're fully vaccinated, and yes, you're protected. The risk of you coming down with severe illness and hospitalization is reduced. But it's for your protection. Your protection. And please do not become complacent and say that our positivity rate is going down, because if you let your guard down, you put us at risk for another wave.
Thank you very much, Dr. Dolland Noel. Dr. Tyhiesia Donald?
So the numbers are going down, but the admissions for chronic diseases are going up. And I just wanted to remind persons that healthy living is important. Let us live healthy, let us hydrate, let us exercise, let us do proper diet, because the chronic illnesses are now going up. We want to ensure that when we roll out our clinics at hospital services, that we get the full cooperation of the public. So we want to remind you that to come into clinics, you have to follow the guidelines. Again, mandatory wearing of face mask, ensuring hand sanitization, and trying to maintain distance as much as is possible. One of the ways of trying to ensure the distancing within our clinics is by appointments. So we're doing appointments. Persons are expected to come 15 minutes before so that you can see your physician for your follow-up. So please, even if you come early, you will not be allowed to come to the clinic. So let us try and work with us. Let us all cooperate with the guidelines, and let us try and see how we could have a smooth rollout of our clinics, which is very much needed given the rise in patients with the non-communicable diseases coming into hospital. In terms of visitors, for the most part, we've been getting cooperation, but we still have a little bit of, difficulty sometimes with some persons. It's not that we don't want you to visit your family members. It's just that we want to protect yourselves, protect the persons in hospital, from getting COVID-19, because sometimes you just don't know. So again, COVID-19 cases are dropping. However, the non-communicables are increasing. So we want to ensure that persons keep that in mind. Let us live healthy. Let us follow the guidelines. And if we want to flatten this curve, remember, the only how this curve can flatten, it's almost totally dependent on us. As my colleague, Dr. Noel, said, at least just wearing your mask properly can help to prevent another spike. So let us all follow the guidelines. Let us wear our mask, and not just wear it, but wear it properly. Let us continue to sanitize our hands. Let us continue to avoid large gatherings. So, avoiding large gatherings, I know everyone is happy, you got a little ease. But let us try. Let us try our best to avoid the gathering. And let us wear our mask properly. And remember, vaccination continues to be the best way to prevent severe illness and hospitalization for patients with COVID-19. So let us all continue to promote vaccination. Let us continue each one tell one. A few weeks ago, I said if everyone tell 5 more persons or have that conversation, we can go a long way. So each one tell one, let us all get vaxxed. It is still our best shot in preventing severe illness and hospitalization, and it also helps to decrease the curve. Thank you.
Thank you so much, Dr. Tyhiesia Donald. And so the final comments from Ms. Hannah Julien-St. Paul.
The Ministry of Health would like to take this opportunity to thank everyone who have been resilient in observing the non-pharmaceutical interventions such as wearing your mask, social distancing, avoiding crowds, hand washing and sanitizing. It is some of these measures that have continued to assist us in the fight against COVID-19. We can only sustain the low level of infections if we continue to observe these personal health and safety measures. Again, we would like to applaud our team for their hard work and dedication. The ministry also expressed thanks to both the public and the private sector. We appreciate your partnership in this fight. We thank you for your support in the form of volunteerism, donations of material resources, the provision of support in the form of human resource, and any other gesture extended to us in this critical time. Our role as health is to make the tool available for the gradual return to normalcy. We call on all to come forward and get vaccinated. We have a window of opportunity at this time while the infection rate is low to protect ourselves. So we ask you again to come forward and get vaccinated. Vaccination is caring, and as we say in community nursing, get vax.
Thank you so much. A good note to end on. So, colleagues, thank you to all of you who joined us via Zoom, or Channel 22, the Facebook page, the YouTube channel, as well as social media and on radio stations, and of course those of you in the diaspora. Now, as was mentioned over and over, with 66% of the population still unvaccinated, we are still very vulnerable. So we need to be as cautious as possible. Yes, we might see the numbers going down, but we are still vulnerable, as was mentioned, so we all have a responsibility to ourselves and our family and our colleagues and our country to do the best that we can. Thank you so much for joining us. I'm Leslie Ann Johnson. We'll see you again next week.